I got an email from, I don't know how to pronounce the name,
Offer?
asking me about bank details.
Yeah.
So I'll make arrangements with him or her. I don't know.
No problem. If you want,
okay.
you can send the details to my email and I will send it to Offer. It's okay.
I was trying to avoid sending all that information over email, but maybe I'll just do that and not worry about it.
You prefer to do it on a phone call? It will be better with you?
Yeah.
No problem.
Okay.
So I think I have your phone number. I will give it to Offer tomorrow and he will call you. No problem.
Great. Perfect. That sounds good.
Okay. You are not on WhatsApp?
No. WeChat, but not WhatsApp.
Okay. No problem. We will call you.
Okay.
Okay, so it's 6 o'clock. I will take a minute and I will speak in Hebrew and then you can introduce yourself and the topic of the lecture, okay?
Okay.
אוקיי, אז אני מקווה שמי שנמצא, שכל מי שנמצא איתנו, קרייג מיד מתחיל את ההרצאה שלו. אנחנו נעשה את זה בפורמט הרגיל ומדי פעם ניתן הפסקות. שוב, נקווה לערב שקט ושזה יעבור בשלום. שאלות לרשום בצ'אט לקרייג. קרייג, you have to take a look at the chat whenever you like. You can do it when you take a break because you are the only one that can see your chat. I cannot see your chat, so they have to write directly to you.
Okay.
And you can take a break whatever you feel that you need and basically whenever you like.
Okay.
So the stage is yours.
Thank you, Yaniv. I'm going to hopefully share my screen. So let me do that first. Yaniv, can you see my my slide? Okay, perfect. So thank you all for being here, and thank you Yaniv and Nadav, my longtime friend, for inviting me. I want to give you an overview of my topic first, and then I'll introduce myself and we'll go from there. So we're going to give you a brief introduction to who I am, and I'm going to do the fastest overview of Chinese herbal medicine that you will ever hear. So we'll do about 20 or 30 minutes just going through the last roughly 2,000 years of the history of Chinese herbal medicine. I'm going to do a little introduction to the clinical trial that I've been a part of for the last year. We will then talk about 3 specific formulas and their application, and we'll go through them each kind of individually. We'll take a little time to talk about the long COVID or post-acute sequelae of COVID, as it's called, and the role of Chinese herbal medicine in that. And then I'll leave some time at the end for questions and answers. So I wanted to just start off by telling you a little bit about who I am. I started studying Chinese medicine in 1990. And interestingly, from my perspective at this point in time, I took a course in school on the Shanghan Lun, which is a text, which is in English, the discussion of cold damage. And this is a classic of Chinese herbal medicine. And at the time, I found the text really incomprehensible. It was very unclear to me at the time of why we were wasting, it felt like we were wasting our time studying something that just seemed to be a relic of the past. And so many of the formulas in the text seemed like they were useful, but the language was odd, the presentations were odd. It just left me really kind of at a loss. But nonetheless, there seemed like there was something that was interesting there. And when I moved to Taiwan in late 1993, I started studying Chinese language there with Nigel Wiseman and with some other folks in Taiwan. And Nigel and I began talking about different classic texts and things that might be worth translating. And out of that conversation grew my desire to actually translate this text, this discussion of cold damage. And that took over the next, 4 to 5 years of my life, really, doing that translation research and all of that with Nigel and with Feng Ye, who is a physician, Chinese medicine physician in Taiwan. And the text came out in 1999, and over the last 20 some years, I have taught from the book and seen patients using the concepts, and I continue through the present day to be fascinated by it and to try and understand how to make clinical applications from this text that was written now close to 2,000 years ago. I have translated other things in the intervening years, and I've learned lots of other things since then, but I continue to return to these classic texts of Chinese herbal medicine because of their depth and their value. I see patients currently. I have since the beginning of my time as an acupuncturist. I teach. I help to run a school which is called the Seattle Institute of East Asian Medicine, and so I'm going to attempt to share with you some of the insights that we have gleaned about the treatment of symptoms related to COVID-19. And I'm going to attempt to frame many of those things in the context of these classic texts of East Asian medicine, Chinese herbal medicine specifically. So I understand that you all are a varied audience, people with lots of different backgrounds and different levels of knowledge about Chinese herbal medicine and about East Asian medicine more broadly. And so I hope that I'm going to be able to bring you all along with me on this journey. And before we, let's see, before we jump into some history, I wanted to just say a word about you all asking questions. You will be able to, you can write questions to me in the chat. I will most likely end up taking those questions predominantly at the end. It's a large audience. We're not in person, which makes all of this more difficult for me, frankly. And so I'm going to try and keep track of what you're asking about. And if there are quick things, I will try and mention them. But for longer or more involved questions, I will most likely wait until the end. So if I don't get to something right away, please be patient and know that I will do my best to answer questions at the end. And we'll leave a good chunk of time at the end for questions. So, okay. So we're going to, as I said, kind of go through this vast, 2,000-year framework of Chinese herbal medicine. And I'm going to frame it around these 4 classic texts. The first one being the Yellow Emperor's Inner Classic. The second being the discussion of cold damage. The third, this formulary from the Taiping era. And the fourth is really not one text, but really a group of texts discussing worm disease. And the reason that I'm doing this is because we have to have some anchor points in this historical trajectory, or we will get lost very quickly. So these texts represent important stopping points throughout the history, and for the latter 3 groups, we will find important formulas that are relevant to the rest of our topic today. So that'll kind of be our outline for us today. I do want to take a moment and call out my colleague, Dr. Shouchun Ma. This is a picture of Dr. Ma. He is an amazing physician. He is originally from Chongqing, studied medicine in Chengdu, And he's really been studying medicine since the 1960s. He's been interested in externally contracted illnesses really all that time. And he has a particular focus on the discussion of cold damage. I have had the good fortune, because Dr. Ma is here in Seattle, I've had the good fortune to work with him, see patients with him, learn from him. And he has been writing about COVID-19 viewed through the lens of Chinese medicine since very, very early in the pandemic. And I think it's important for me to let you all know that, you know, early on, Dan Bensky and Dan is also here in Seattle, and Dan and I translated some of Dr. Ma's writing into English for publication in the Lantern, which is a journal out of Australia, which hopefully some of you are familiar with. That article was, I think, incredibly, not only elegantly written, but not ours, but Dr. Ma's, was really elegantly written, and it was prescient. It really he had a really clear and an excellent idea about the workings of COVID from a Chinese medicine perspective very early on. And because, you know, Dan and Dr. Ma and I have seen patients together over the last year, this article and my understanding of it has really influenced in a major way the way that I have gone about treating patients who have symptoms related to COVID. So it's the article itself is available on the Lantern website. All of the stuff related to COVID is free for download from their website, and I can't really encourage you strongly enough, if you're interested in this, in the Chinese medicine approach to this topic. It's an excellent piece and has been very valuable to us. So I just wanted to thank Dr. Ma and make sure that you all know him and how much he's influenced my work. So let's jump into the Yellow Emperor's Inner Classic. This is often referred to as the Neijing. This text was written, you know, very early, over a span of hundreds of years, right? So the earliest sections of it probably are as early as the 4th century BCE, and then all the way up through the 2nd century. It was clearly not written by a single author, and it is important because it represents some key foundational areas: fundamental theory, basics of diagnosis, channel theory, acupuncture. There's a lot of stuff that is important to us still to this day that we can find in the Yellow Emperor's Classic. For us today, with a topic of symptoms related to COVID-19, we get some key concepts that we can see represented in the Neijing. The first is, we have come to think about COVID-19 as a warm epidemic disease. It is caused by, from a Chinese medicine point of view, it's caused by what we refer to as pestilential qi. That pestilential qi, we'll talk about a little bit more as we go along, but it generates toxin inside the body. And it is often, that toxin is often complicated by what we refer to as foul turbidity. The foul turbidity is a special kind of damp pathogen. And the combination of these things forms kind of the backbone of an important understanding of a way to approach this illness. And so I'm going to try and walk us through each of these things a little bit so that we can all be roughly oriented in the same direction. Yaniv, I just wanted to tell you, there are people in the waiting room, and I don't know if I'm supposed to be admitting them. Okay, you'll take care of that? Thanks. So for those of you who might have some familiarity with Chinese medicine or East Asian medicine, we often refer to the 6 pathogens. So cold, heat, dryness, dampness, wind, summer heat. These are the kind of standard group of pathogenic entities that we often talk about. Pestilential qi is different than these. It kind of stands on its own as a notably different kind of pathogen, and we'll talk about why that is. It is thought to be more deadly, and it is thought to be infectious in a way that the typical 6 pathogens are not thought to be. It is, as I said, important because it leads to toxin inside the body, which is an important thing that has to be addressed in a specific way. And the one thing, just as a historical note, is that the Neijing, while it talks about pestilential qi and the way it manifests and the way it develops, it doesn't really talk about specific treatment strategies. So the Neijing is very, in many ways, helpful in terms of orienting us to the fundamental theory, but it doesn't, especially for Chinese herbal medicine, it doesn't provide anything in the way of treatment approaches. So we'll have to look elsewhere for that. Just a quick word about toxin. Toxin in East Asian medicine broadly, Chinese herbal medicine specifically, is this diffuse concept that it is a certain kind of pathogenic entity inside the body. It's considered to be more virulent, more damaging, more severe. It causes typically severe dysfunction in the body. And one of the important things about toxin is that it often can impair normal physiologic function in a way that starts to create other problems. Now, in the context of COVID, what we see is that the toxin seems to lead to the development of this foul turbidity. This is, as I said, a damp pathogen. It's very sticky, it's very gummy, and this makes it difficult to resolve these kinds of patterns quickly. So we have essentially in the case of COVID-19, pestilential qi coming from the outside, leading to this development of toxin and foul turbidity, and that creates a disease that is symptomatically severe in many cases, deeply damaging to the body, and difficult to treat quickly. Obviously, this is not true for all patients who contract COVID. This is one of the confounding things about it. It doesn't affect everybody the same way, but that's not really anything new for us in terms of Chinese herbal medicine. We know that the same disease can affect different people differently for lots of reasons. So pestilential qi is more commonly going to occur when normal weather and climatic conditions are altered by something. So that alteration of normal patterns creates, from a Chinese herbal medicine point of view, this abnormal qi in the environment. And according to the Neijing, when that abnormal qi encounters somebody with a weakness of their defense system, the anti-pathogenic qi, that leads to illness. If the anti-pathogenic qi is strong enough, this is the zheng qi, if it's strong enough, then what the Neijing says is that you don't get sick. Now, one of the things that we want to note about this unique pestilential qi is that what seems to be true is that even for patients who have strong antipathogenic qi, pestilential qi is still able to break through that and cause illness. So whereas many of the kind of the normal 6 pathogens don't so much seem to do that, so strong, healthy patients really less likely to get sick. But when pestilential qi is involved, the scales tip a little bit in favor of the pathogenic qi. So that is one thing that we have seen very clearly in our telehealth clinics, working with patients who have contracted COVID, that many of them, from what we can tell, were strong, healthy, active people before they got sick. And that's something that's maybe a little bit different from what we see with those other pathogens. Just a quick note about heterogeneity. One of the things that I think has happened in our, certainly in the community of Chinese herbal medicine practitioners, and I don't know what this is like in Israel, my apologies. I know my own community and in the United States, there has been this seeming desire, which I think reflects a desire more broadly in our culture, for people to kind of stake out their territory and their turf and be unwilling to consider or look at other things seriously. And I want to just make a quick comment that East Asian medicine broadly, and Chinese herbal medicine specifically, has been heterogeneous since its inception. The Neijing itself, this Yellow Emperor's Inner Classic, as I said, it was written over many centuries. It was clearly written by multiple authors, and it, even within that text, it's not completely congruent from chapter to chapter. It presents different ideas, different ways of looking at things, and this is a foundational text of our medicine. So I would just encourage you, you're going to see, we're going to look at things from several very different perspectives. And I think that mindset is critical for us. And so I'm going to encourage us in that direction at every possible point. So let's talk a little bit about the discussion of cold damage. This is a Han Dynasty, so 3rd century text. It was written by, as far as we know, it was written by a physician named Zhang Zhongjing. It's considered to be one of the first places that we get important information about herbal approaches to pandemic diseases. And interestingly, Zhang Zhongjing, although I think a close reading of the text, you can find information about pandemic diseases, he doesn't talk about pestilential qi or epidemic disease or toxin or foul turbidity or any of those things. Maybe there's a tiny little mention in sub parts of the text, but the bulk of the text doesn't deal with those things. He does, however, deal specifically with pathogenic invasion and its direct and indirect effects. And he's specifically talking about that in the context of cold pathogens. So it's called the discussion of cold damage because the pathogenic entity that's involved is cold. And I'll expand on that a little bit, but that's a good starting point. It's also true that even if we don't find anything in the Shanghan Lun, the discussion of cold damage, specifically about warm epidemic disease, we definitely find formulas that are effective. So, so we'll kind of keep those two things separate a little bit. This is a fundamental axiom of Chinese herbal medicine, and I just want to put it up here because it's foundational to me. So different diseases can be treated with the same formula. different formulas can be used to treat the same disease, right? So this is, to me, this captures in many ways this fundamental power of Chinese herbal medicine, that we need to do differential diagnosis, and we need to understand whatever disease we're looking at through the lens of East Asian medicine in order to be able to apply the formulas that are rooted in East Asian medicine, would be my suggestion. So a very quick overview of the discussion of cold damage. I'm trying to create an orientation for everybody so that when we talk about the formulas, you will have, for those of you who haven't studied the discussion of cold damage specifically, that you'll have at least a framework in which you can place what I'm talking about. So you may have heard of 6-channel theory. The discussion of cold damage is the place where that kind of takes its root in Chinese herbal medicine. We also get this idea of pattern differentiation comes, even though it's not mentioned by name in the text, the concepts are there. And there's just over 100 formulas that come out of the text. And many of these formulas are still used clinically today. They're very important. They're foundational formulas. And so we can look at the text in multiple ways. The other thing that I think is important is that the framework is patient and what's going on with the patient, pathogen, what kind of pathogen, how it enters, and then the third factor, which is actually surprisingly important even in modern practice, is what other treatments have been done, and was the patient treated properly prior to them seeing me or you? So we'll talk more about that. At the risk of, for some of you, this will obviously be review, but I just want to, these are the channels that are associated with the 6 channels of 6-channel theory. So the greater yang, urinary bladder, small intestine; lesser yang, gallbladder, triple burner; yang, brightness, stomach, large intestine; greater yin, lung and spleen; lesser yin, heart and kidney; reverting yin, liver and pericardium. So just a very, again, a quick note. When we talk about the channels here, in your mind, I would encourage you to put the word channel in quotes, because it doesn't just mean the exterior channels on the body. There's a lot of different ideas about what this term means in this context, but for our purposes, what we want to think about is it represents the exterior pathway of the channel. It represents sections of the body that are covered by those channel pathways. It represents the organ systems that are associated with those channels, and the functions that are associated with those channels and those organs. So it's a big, broad thing that it represents. Okay, let's move on. So when we think about this system, this 6-channel theory, we think about pathogenic invasion by cold, oftentimes through the greater yang channel. That's the most exterior part of the body. The thing is, though, it's important for you to understand that pathogens can invade more directly into a deeper part of the body. They can also quickly move from greater yang into another part of the body. They can move from a more interior part of the body out to the greater yang. The pathogen can really go to any of these places in the body, depending upon patient constitution, depending upon treatments that are done or not done, depending upon, maybe supplements that are taken or other forms of treatment that are used. There's all kinds of variables that can affect that. We also, when we look at the entry of a pathogen into the body, it also can give us some ideas about the health and the functioning of the internal organs of the body. Because places in the body that are less healthy, that are not functioning as well, will be more likely to be affected by an externally contracted pathogen. So sometimes in retrospect, we can see, oh, pathogen went into this place, therefore we can suspect that there is a problem in that organ system. I just want to mention that because we're looking at externally contracted pathogens as a starting point, we often consider what's happening in terms of fever and chills. This is a very basic framework, but it can be useful just to have this in the back of your mind. So in the greater yang channel system, we tend to see fever and chills simultaneously occurring. In the lesser yang, we start to see alternating fever and chills. In the yang brightness, we see fever, but typically no chills. You see aversion to heat in these patients. And then in the yin channels, all three of them, those systems, we tend to see no fever at all, or a very low fever and aversion to cold or chills. So again, this is a very simplistic overview of the system, but useful, I think, as a framework. So just for a moment, I just want to talk about what it means for the body to be invaded by a pathogen, cold or otherwise. People have answered this question in many, many different ways throughout the history of East Asian medicine. So I've mentioned before, more virulent pathogens tend to arise during unseasonal weather, but we have to remember that bacteria and viruses were not a known thing when some of these foundational texts were written. So physicians were looking, they were observing patients, they were thinking about their clinical experience, they were thinking about, okay, something caused the body to change, the person to become unwell. So some physicians viewed the invasion of a pathogen really as a change in the physiology, that the pathogen was basically an issue of physiologic function or malfunction. And though that kind of school of thought was, well, the pathogen isn't really a thing. It's just something that happened to the body. Whereas there were other physicians who, even in the early years of East Asian medicine, said, no, there's actually a thing. There's some kind of entity that gets into the body and inflicts damage on the body and causes organs or channel systems to malfunction. So even in the early years of East Asian medicine, we can see people adopting this more functional perspective versus a more maybe organic perspective. So again, just a reminder about this heterogeneity of this medicine and different approaches used by different people over different times. Okay, whoops, why is my slide? There we go. So one of the important things about the discussion of cold damage is that we are often thinking about short-term application of a formula to expel a pathogen. The formula pushes out the pathogen so the body can restore its normal functioning. The important thing to remember about this is that pathogens can get stuck. They can get lodged in the body. And when they do that, they can interrupt the functioning of both local systems, but also systemic processes. And if you don't get rid of the pathogen, you can't typically fix those processes or functions. So I'll just give you one simple example. Cold pathogen comes in to the exterior of the body, gets trapped in the greater yang channel system. When it does that, that can impair the body's ability to regulate temperature and to regulate sweating. that can create a disharmony between the nutritive qi, the yang qi, and the protective or wei qi at the exterior of the body. And you can end up with a patient who many, I'm sorry, I'm getting a note that says the host has asked you to start your video. Have you lost my video?
Yeah,
okay.
the camera was closed, now it's open.
Okay, thank you. So when that disharmony happens, you can end up with a patient who has spontaneous sweating and who is chilled all the time or has a tendency to be. And that can go on for months, even sometimes I think years. It's an externally contracted pathogen. It's stuck in the most outer layers of the body, but it causes a long-term problem. And then what I would do for that is I would use a formula called cinnamon twig decoction or guizhitang to expel that pathogen. And then the body is able to restore that functioning. And as I said, that might be 6 months or a year after the initial contraction. There's nothing that says that an externally contracted illness has to finish after 3 days or 7 days or anything. There's no time limit. It just depends on how the body is functioning and what kind of pathogen it is and how it's working in the body or causing problems in the body. Okay. I just want to give you, this is just a list of formulas that we have used in treating symptoms related to COVID-19. This is just it's a handful of them. These are some, I would say, ones that came up more than a few times. These are all formulas from the discussion of cold damage and just gives you an idea of the range of them. So I'm not going to go through them each. I'm not going to go through each of them. I just want you to have them as a reference. Okay, so that is the quickest that I ever went through the discussion of cold damage. Let's talk a little bit about this formulary text from the 12th century. When we think about books like the discussion of cold damage, they present a specific diagnostic framework and then they put formulas into that context. This formulary is a totally different thing. It was a government compilation. Basically the Imperial Medical Bureau sent physicians out into the country and said, go find formulas that are being used commonly that seem to be effective for different things, and let's put them all together in one big book. And that's what they did. They didn't have any particular framework except that the formulas were effective and that they seemed to be used by, a fair number of people. They don't have any guiding overview or framework for them. And so what we find in this formulary is these formulas are all over the place, as you might imagine. And one of the interesting things about this particular text is that if you are a practitioner who uses Chinese herbal formulas, you will find tons and tons of the commonly used formulas come from this book. And so even though it was compiled in the 12th century, we still are making use of the insights that those physicians at that time period and before them had. So it's an incredibly valuable text, even though it doesn't provide really a diagnostic framework. And it's definitely not focused on treating epidemic or pandemic diseases, but nonetheless, we still find some formulas that are useful in that context. So just a few examples of formulas that come from the Taiping formulary. Huosheng Zhengqi San is a big one, and we're going to be talking about that formula at some length later on in this talk. Erchen Tang, Sujunzi Tang, Chuanchong Chatiao San. These are formulas that are very commonly used, not all of them necessarily for symptoms related to COVID, but very common formulas. So quite important text. And then finally, we have this warm disease tradition. And we're now kind of shifting into the 13th and 14th century, but really all the way through the modern era. One of the things that we have to be aware of is that the warm disease school does not have a single foundational text. So unlike the cold damage school, which everything refers back to discussion of cold damage and or commentaries that have been written about that text. The warm disease tradition has all these different texts that were written, and I'm going to mention a couple of them so that you again have some orientation to them. This kind of movement into warm disease represents a very, very important development in the history of Chinese herbal medicine, because it's an engagement with a new kind of pathogen. And I'll leave that there, and we'll talk about that as we go along here. Just a little pause here for a moment. I want to, so for people who are not at all involved in the world of Chinese herbal medicine specifically, maybe this will not be so meaningful, but for those of you who are at least a little bit, I want to, this is like a public service announcement, sort of. There are people out in our community, there have always been since the 13th century, who will try and draw these very sharp distinctions between the approaches used in the warm disease school and the approaches used in the cold damage school. And this, again, to me, is mostly a turf war. And it's not really about things that we should care about as physicians who are mostly concerned about helping our patients. When you actually, one of the things that I feel lucky to have been able to do is that I have studied Chinese and I have spent a lot of time reading traditional texts. When you actually read the warm disease texts, the very, very first thing that occurred to me as a younger student is that the warm disease physicians, not only do they reference the cold damage tradition, they use formulas from the discussion of cold damage. They orient around that, and then they say, look, you know, these are great. We like to use these things, but they're not always the right thing. So sometimes we have to use these other approaches. And then they lay out, you know, how are they different? Well, warm disease looks at pathogens that are warm. I mean, it sounds silly, but they're warm or hot pathogens, right? They enter the body differently. They seem to do different things when they're inside the body. And that difference is important, but there's not this kind of harsh delineation between the two traditions. And I think if our main goal is not to like stake out our turf, but to actually help patients we're working with, the best thing for us to do is to learn them both and understand when one is appropriate and when the other is appropriate. So that's what I'm going to kind of, again, I'm going to orient us to that perspective. So the first person I want to mention, and I'll just say that for me, I think it's very important that we have an engagement with these people who have come before us, these physicians who, you know, we stand on their shoulders, or however you want to say that. So I like to mention names of people because I think it's important for us to call them out and recognize their contribution. Wu Youke, 17th century physician, wrote a book called The Discussion of Warm Epidemics in 1642. Incredibly important text. It lays this framework for how to deal with epidemic or pandemic diseases. Wu Youke very importantly talked about these critical concepts of pestilential qi and it becoming toxin inside the body. He talked about the transmission of these kinds of epidemics from person to person. which was a radical concept at the time. He talked about the fact that these kinds of warm diseases seem to enter the body through the nose and the mouth and not, oh, I think I've been signed out somehow. Sorry.
No, you are here. I'll stop your screen sharing, and then you will, yeah, you can start again.
Okay. Hold on. Sorry about that. Technical difficulties.
That's okay.
I was on a roll there too. Okay, let's see. Are we back?
Yeah.
Okay, cool. So in the discussion of cold damage, we think about pathogens entering through the skin, the channels, the muscles, and especially in the back of the body. The warm disease physicians started talking about pathogens entering the front, the nose, the mouth, and then therefore going directly into the lung, right? Which is a key thing for us. Interestingly, Wu Yo Ke also talked about disease latency, about people getting sick, but not being symptomatic yet, right? I mean, to me, that's amazing that he was writing about that in the 17th century. So there's a lot to learn. Okay, he also, I've said this, he contrasted the warm disease with the cold damage. He also, though, mentioned this really interesting idea of the membrane source, which is this kind of area of the body, which is a half interior, half exterior structure. It relates in some ways to the lesser yang channel system in the cold damage tradition. And he wrote a formula called Da Yuan Yin, or reach the source drink, which is useful for symptoms related to COVID-19, but particularly for more severe cases of it. So just to be aware of that. The next person I want to mention is Yetian. We're now in the 18th century. He wrote this text called Studies as a Guide to Clinical Practice in 1746. He talked about the idea of acute illness versus pathogens that can be lurking, right? So the idea of a warm disease pathogen getting lodged within the body, remaining there for a long period of time, and leading to chronic illness. And that's something that we continue to use, that concept today. Yetian has another text called The Discussion of Warm Heat Pathogen Disorders, or the Wenre Lun, 1792. And this is where the 4-level diagnosis comes from, for those of you who have heard of that. The protective, the qi, the nutritive, and the blood levels, kind of laying out this new, at the time, very new diagnostic framework. I will also mention that Yetian stressed the idea of the importance of tongue diagnosis. And we have found that very important for treating symptoms related to COVID-19, in part because we've been doing so much of this via telehealth. And while we can't take the pulse, we can look at the tongue. And so that's been very important to us. The last person I'll mention is Wu Jutong, who is an 18th century physician. He wrote what many people would consider to be one of the foundational texts for the warm disease school, which is the systematic differentiation of warm pathogen diseases, the Wenbing Tiaobian. We get lots of key concepts out of this text. So triple burner diagnosis, which is the idea of looking at illnesses as they affect the upper, middle, and lower burners of the body. Wu Jutong made a big deal about looking at diseases, warm diseases that include dampness as a component, and warm diseases that don't include dampness as a component. This differentiation is very important. It's very important in the context of symptoms related to COVID. The other thing is that Wujutong makes a big deal about preserving the yin and the essence. This is a little bit of a contrast to the discussion of cold damage, which focuses more on yang qi and body fluids. So some important differences in formula writing approach. The other thing that Wu mentions is how important the issue of seasonal and environmental factors are. And he had a lot to say about that and is an important source of information about those concepts. These three formulas, Yin Chao San, Sang Ju Yin, San Ren Tong, come out of this warm disease text. There's lots of others that are also quite commonly used, but I thought that these probably are formulas that you may have heard of before. And so Wujutong includes lots of excellent formulas that we still use. So I want to end this very brief overview of history with kind of trying to put together how we can use this historical overview and this information to kind of craft a framework for looking at symptoms related to COVID. So we hypothesize that COVID is not a cold damage condition, but a warm disease epidemic. It is characterized by the presence of pestilential qi, which is particularly virulent and harmful, and capable of penetrating into people even if they're healthy. The pestilential qi, once it's inside the body, gives rise to toxin and foul turbidity. The toxin produces more damage inside the body than other pathologies. And when it's combined with this foul turbidity, this pathological dampness, it gums up, it makes stickiness inside the body so that the interior workings are messed up. They're not working so well. Treatment then is difficult and tends to last longer. The other important thing to note is that when you get damp toxins inside the body, they tend to impact the normal movement of the blood, right? Dampness is a yin pathogen, the blood is a yin substance, and they tend to lead to problems with the normal movement of the blood, which creates problems with circulatory issues and other issues related to blood stasis. Very important for symptoms related to COVID-19. There are many, many symptoms that we have seen. This is a short list, right? Symptoms that we've seen commonly relate to, okay, pathogen goes in through the nose and the mouth, goes into the lungs, sits in the upper burner. So once it's in the lungs, cough, shortness of breath, stifling sensation in the chest. The other thing is that when we interrupt the normal functioning of the lungs don't manage the qi in the body as well as they're supposed to. That leads to fatigue. This fatigue, as maybe some of you have seen, or maybe all of you have seen patients with this, it can be overwhelming to patients. Can be very deep and severe fatigue. The damp toxin in the upper burner also can impair heart function. So we can see irregular heartbeat, palpitations. This can lead to anxiety. And that can also lead to impairments of normal blood flow, which can then cause things like numbness in the extremities, abnormal skin sensations. And we also can see, as the pathogen affects the middle burner, nausea, poor appetite, abdominal pain. Many of these patients lose the sense of taste and smell. And the pathogen can also enter the lower burner and give rise to problems affecting the urinary system and the bowel. So we can really see this idea of triple burner diagnosis really in action with these differing symptoms of COVID. I want to just say a quick note about triple burner means upper, middle, lower, but triple burner also relates to the idea of the interstices in the body. So the triple burner as an organ and as a body system, this interstices, these are these very small connecting pathways inside the body that probably relate to fascia and fascial planes inside the body. They're everywhere. And they provide a substrate for exchange and for interaction throughout the body. And traditionally, they were looked at as an area through which both normal body fluids and yang qi circulate. So when we impair the triple burner, we impair the movement of fluids, and we impair the movement of the yang qi, and especially the ministerial fire, which I will come back to. So I hope we're starting to get an idea of kind of where these symptoms arise from, and how that understanding, we can actually find that understanding in the history of this medicine. I hope I conveyed that. So I'm going to switch gears for a couple minutes, talk about the study, and then we're going to take a break because I know we've been at this for a little bit. So our study is describing Chinese herbal medicine telehealth care for symptoms related to infectious diseases such as COVID-19. It is an observational trial. So what we're doing is we are seeing patients in the normal way that we would over telehealth. We're giving them whatever we decide we want to give to them. There's no restrictions. We're not putting some people in an experimental group and some people in a control group or anything like that. All we're doing is a natural observation of what is it like to treat patients using Chinese herbal medicine? How do they respond? What do we see? And we're observing that, and we're tracking it, and we're trying to maybe make some decisions and draw some conclusions from that. We mostly have used granules in our clinic because of the relative ease of patients using them, and because we sometimes had to ship herbs to people. Obviously, it's easier to ship a little package of granules than a big bag of Chinese herbs, raw herbs. I just want to mention one quick thing before I'm going to just give you a few formulas that we've used. You know, the Pacific Northwest. Oh, Yaniv.
Just a small question. The granules, the concentration 5:1, or it's a powder?
So the granules, I mean, this whole, you've opened up a little can of worms, Yaniv, because the granules are not all 5:1, right?
4:1.
Okay, there's a range though, and depending upon the manufacturer. So, but yes, it's those kind of granules, not a raw powder.
Not a raw, so it's a dried extract?
Yes, exactly. Pacific Northwest in the United States, you know, I live in Seattle. We have a very different climate than Israel, as I'm sure you're all familiar. We get more rain. We never get as hot as you guys get. So I want to frame everything that I'm saying as, you know, you may experience different things with your own patient population. I'm going to share the insights that we've found with our patients, and hopefully they are relevant, but you may find that, for example, some of the issues that with dampness that we see may present a little bit differently in your climate. So just a reminder about that. You have this list. These are probably, you know, top 10 formulas that we used. So I'm not going to go through them. I'll talk about 3 of them specifically, but you can reference these if you're interested in learning more about them. I will just say, I've really said this already, but I want to just hit it one more time and then we'll stop. You know, from my perspective, Chinese herbal medicine, the power and the strength of it lies in differential diagnosis. So one of the things that that we have found is we have seen patients in our clinic who all have a COVID diagnosis, and they have really been such wide-ranging ultimate diagnoses that it was really shocking to us at the beginning. There was one of the very early clinics that we did. We had 3 patients in one afternoon, right in a row. One of them we used a cold damage formula for. One of them we used a warm disease formula for. One of them we used one of these other weird formulas that doesn't come from any of those texts. And Dan and I, at the end of that shift, looked at each other and said, wow, okay, well, this is going to be interesting treating these patients, right? Because they are literally all over the place. So I would just say there is no one formula approach that I believe is effective for COVID or for symptoms related to COVID. Differential diagnosis is the key to helping these patients. So with that, I'm going to press pause and let you see this lovely picture and take a 10-minute break. And I will see you back in 10 minutes.